Hi everyone, this is Dr. Susan Marra with Dr. Marra's Medical Minutes, and today we're going to talk about how to manage neuroinflammation. Neuroinflammation is obviously a consequence of when you have infections that cross the blood-brain barrier and they get up into the astrocytes and the glial cells up in the brain and can cause inflammation. Neuroinflammation feels like there's pressure in your head, or it can feel like you have a tight band around your brain like that. And it oftentimes will interfere with your processing speed, your executive functions like cognition, knowing where you are in space, memory, emotional regulation, things like that. The emotional regulation and the regulation of the limbic system, I've found to be what helps the regulation of the limbic system is the use of the vagus nerve stimulator. And I'm not exactly sure why, because they're not, the vagus nerve is not part of the limbic system. It may just be a byproduct. And I really see it to be helpful in that way. But the neuroinflammation piece to tick-borne illness and mycotoxin illness and COVID-19 is also the result of the SIRS pathway, chronic inflammatory response syndrome, as well as the release of pro-inflammatory cytokines like IL-6. So when these molecules get released and they cause neuroinflammation, it really interferes with the patient's ability to think, to problem solve, to perceive things accurately. And a couple of the nutrients, I just spoke with a pharmacist at InfuServe who they specialize in compounding substances for tick-borne illness and mycotoxin illness. So I trust them a lot. And they told me that a cocktail of 3 things is really great for treating neuroinflammation. One is oxytocin. Oxytocin, I just did a webinar on that, or not a webinar, a medical minutes on that. It's a neurohormone that's released in the posterior pituitary gland. It's very responsible for bonding in mammals. So bonding for mammals in a social group and bonding to the mother. So oxytocin is one. Another one is naltrexone. Naltrexone is an immune modulator, and it can help with sleep. In very rare cases, it has a paradoxical effect, and it will keep people up at night. And so what you want to do is you want to take it in the morning. Okay, you don't want to, sleep is a priority when you're trying to heal from these infections. At least 8 hours of sleep a night. And then the third thing, which I wasn't aware of, is Alpha-Lipoic Acid. And, that's a nutraceutical. And you can start with 300 milligrams twice a day. And if you need to, go up to 600 milligrams twice a day. I did inquire about using DMSO because I think that would be a great thing, but there's only one study and they use between 3 and 20 grams of DMSO. Well, that's not doable. That's not reasonable. So DMSO is not a good remedy for neuroinflammation. However, it is a good remedy, like if you put a little bit here when you have a headache, or if you have joint pain, like in your elbows or in your ankles, you can put DMSO there, and then put like a stocking or a sock that you've cut the end off, you've cut the toes off of, and you can put the sock over it. And that will help lower inflammation as well. But orally, DMSO probably isn't a good bet. So the 3 substances, 2 of which you have to get at a compounding pharmacy that are going to be really helpful for neuroinflammation are oxytocin, naltrexone, and alpha-lipoic acid. So I hope you found this information helpful, and I hope you have a wonderful day. Take care.